Hello everyone, this is Dr. Raj Singh. I'm the medical director at Healor. Today we are doing a testosterone pellet procedure. This is for a female client of mine. So contrary to the popular belief, women also need testosterone, and as the testosterone levels decline, then we can have issues like weight gain, emotional problems, lack of sex drive, urinary incontinence, and many others. And it's hard to get motivated also, and the estrogen can become more dominant, causing tearfulness or emotional or depression, things like that. So today in our client, we're doing testosterone only, and that generally fixes hot flashes and those type of symptoms in about 90% of the individuals. I do not like to use estrogen therapy unless absolutely needed. So in this case, we are selecting only to do 2 of the testosterone pellets. Simple outpatient procedure takes about 10-15 minutes. And once we insert the pellets, it takes about 7 to 10 days for the pellets to start working, and they can last for about 5-6 months. However, everyone's metabolism is different. I have some clients, we do the pellets every 8 to 10 months. And some who need a little bit sooner, in about 4. So that's it. Let's get started. Still good?
Yeah,
Still good?
yeah.
Any pain?
Oh, right there.
And it hurts?
A little bit, yeah.
Okay?
Mm-hmm.
Okay?
Yep.
Okay. Okay, so we have the trocar in the right depth. So I'm going to drop the testosterone pellets in there. This is what they look like. They're tiny, but they do last several months because they're in the fat layer where there's very little blood supply, so they slowly dissolve. And we are done with the procedure. I'm going to put some dressing there.
Gosh, that was
And we can focus. And then, so that's how we do the procedure. I'll put some dressing. The main thing is to remember not to get in the pool or hot tub or swim for next 3 to 4 days, because the track where we did the pellets is still open. So we don't want any water to get in. Plus water has bacteria, so it can cause infection. Exercising is not allowed. You can do all the walking you want, but just no running, no jogging, because we don't want a lot of pressure in this area. Okay. And the dressing is there. It's waterproof dressing, so shower is completely fine.
Okay.
And then the dressing, you can just take it off in 2-3 days. It'll automatically come off also.
Okay.
And I'm just going to put a touch of dressing, and then we are done. See, that wasn't too bad at all, right?
No, not at all.
Okay, so I'm going to put some dressing here.
I think the line clean was the first.
The lidocaine was the hard part. Yeah, it's just tend to stink. These steady strips try to keep the bone a little bit more approximated. And yes, I do want you to stop taking all your other medication, all the other hormones, okay?
So over progesterone.
Progesterone is okay to take,
Okay.
just no estrogen.
Okay, no estrogen.
Mhm.
Perfect.
Thank you everyone for watching. That's how we do hormone pellets. This was for our female client. And if you need to come and see us, we are at Healor. And the website is healor.com, and the phone number for consultation is 702-362-2273. This is Dr. Singh from Las Vegas. Thank you very much.